Have you ever had the experience where this part of your neck hurts, but then your chiropractor is working on this part of your neck? Let's talk about what is happening. Welcome back. And if you're new here, I'm Dr. Anjali, the founder of Back in Balance. I'm a non cracking, non popping chiropractor and integrative functional medicine specialist. I love helping families and workplaces optimize their health by moving well, eating well, and living well. And I'm especially passionate about empowering families as they navigate the 5 trimesters from preconception to postpartum and beyond by taking a 360 approach to nervous system regulation. So let's talk about misalignments, or some chiropractors refer to them as subluxations. So let's talk about what that means. So I would say most commonly when we have a misalignment in our spine, it's very common that it would be a rotational misalignment, right? So if you can kind of imagine, there'd be a rotational component to it, which means that because, I mean, I very much exaggerate this. This is not what happens in your spine, but just for visual purposes, let's just pretend that this is the rotation that takes place. So because you have muscles that attach on both sides of your spine, right? You have many muscles. When there is a misalignment, one side of the musculature will become overly contracted and one side of the musculature becomes overly stretched. And so where you feel that can vary, right? Because pain is subjective. And so, well, not just subjective, but the body is always compensating and adapting. So we don't know, we just know where we feel it. We don't know what the root cause is. And so when we have that happen, the body has to kind of compensate and adapt even in the spine, right? So one other way to think about it is that if you were holding a piece of rope, right, on both ends, if you're holding it vertically, if you twist one end but keep holding the other end, there will be a sustained twist. But along with that twist, there'll be other aspects of that rope that are also twisted, maybe not to the same degree, but they have to compensate for that big twist. If you let go of one end, let's just say the bottom end with gravity, you let go of that other end of the rope, it will find its way back to being a straight rope. The other analogy I like to give is in a very exaggerated way, like our spines are kind of like tomato vines, right? Like if you've ever grown tomatoes or seen a tomato plant growing, the tomato plant will grow, but it can grow in a variety of directions. It can have some twists and turns. So our spines are not that exaggerated. Our spines will generally grow in the right direction, but there might be some misalignments or some rotational, maybe it goes side to side, maybe it goes front to back. It's not as common, but it can happen. But all of these things can be our body's way of adapting and compensating over time, right? And so our goal as chiropractors is to help reestablish that alignment in your spine. And one of the big reasons we focus on the spine so much is because that is where the nerves are coming from, right? From the brain to the brainstem, the spinal cord is where all of the nerves are splitting off of in order to distribute that information to the rest of our body. So you might have symptoms in your wrist or your elbow or your ankle or your knee, but the body is always compensating and most commonly impacting how your spine is aligned. So let's talk a little bit, maybe if you've ever sprained your ankle, right? You might have the experience of changing your gait, the way you walk, to accommodate for the sprained ankle. And then many times people will actually develop symptoms, perhaps this has happened to you, where the other leg, the non-injured leg, actually starts to create some discomfort or some symptoms because it is now doing a bigger chunk of the work, right? Or you've changed your gait, you've compensated in the way that you're using your muscles and tissues and how everything is getting redistributed. When the original ankle heals, you might return back to a similar gait, or you might now have a slightly different gait than you did before the injury, right after the injury, and now you might have a new gait because now your body has kind of navigated into something different. And sometimes that can make it feel like our body is pretty fragile, and it's not actually. It's really, really amazing and really, really strong because it is always taking this information and trying to adapt and compensate. However, if we kind of lose sight or forget about all the things that our parents probably told us when we were younger, like getting water and eating our meals on time, eating nourishing meals and getting enough sleep and going to bed on time and doing all of those things, right? Sometimes because we don't feel the impact of that happening right away, it's such a gradual progression. And we may not have pain in of itself. We have another video talking about pain, which you can check out. But we may not have that pain feedback, and especially so many kids, right? they become so resilient, they just kind of bounce back. And so when we don't have that pain present right away, we just kind of continue doing the things that we're doing. And so then over time our body will adapt and compensate. And so as a chiropractor, I really look at what is happening in the full spine. So like we talked about in that rope analogy, right? It can be impacting different areas of the body. And so even though someone might be coming in with very specific, let's say left low back pain, it might be that the left side is on the side of contraction of the muscles. It might be the left side is the side of the overstretch. There isn't really a way to correlate in advance to say that people will feel pain or symptoms on the side of contraction or on the side of the overstretch. We don't have a way to, or at least I don't have a way to identify or predict that. So that's why we look at what's happening on the side of discomfort, what's happening on the other side, what do we need to adjust in terms of its alignment. But then also for me, I look at what's happening on the other end of the spine, because I don't know where the body is compensating and how it's impacting other areas of the body. So for my practice members, I look at how are things moving in their pelvis, their low back, their mid back, their neck, all of it, because I really want to help restore as much balance. I want to help restore the nervous system to the best of my ability in that visit. So if you are in the Bay Area and looking for someone to really help identify what the root cause of your physical pain symptoms are and really take a 360 approach, because it may be structure, it may be function. We talk about that in another video as well, but really helping to identify how we can not just manage pain, but really address these misalignments which have resulted over a period of time to really establishing a much stronger threshold, so that if you sprain your ankle again or something happens, it becomes a much smaller blip on your journey, as opposed to being something that really takes you out of commission for a longer stretch of time or really impacts your life a lot more significantly. So if you're in the Bay Area and looking for that, I'd be happy to chat with you. There's a link to book a discovery call with me down below. And if you are not in the Bay Area and are looking for somebody, please reach out if you would like some help in finding someone who can better assist you. Thanks for joining me, and I'll see you next week.